पॉलिसी बाजार पर 1 करोड़ रुपए का टर्म लाइफ इंश्योरेंस केवल 450 रुपए महीने से शुरू।
COVID preparedness drills that are being conducted across the country. Hospitals across the country are holding a drill today to assess their preparedness to tackle any possible spike in COVID cases after a surge was reported in China. Now, today morning, Union Health Minister Mansukh Mandaviya visited Delhi's Safdarjung hospital to oversee this mock drill, and he said that the hospital is ready to tackle COVID-19, and he also advised states to be fully prepared. Now, the government says that while there is no surge of COVID cases in India and there's nothing to panic about yet, these are steps being taken just to prepare for any possible surge if at all India witnesses one.
देश में कोविड की महामारी न फैले या तो कोविड के केस बढ़े, उसके लिए प्रधानमंत्री जी ने निर्देश दिया है कि हमें सतर्क रहना है, तैयारी करनी है। उसको देखते हुए लगातार भारत सरकार की ओर से कोविड आने वाले दिनों में देश में न फैले उसके लिए तैयारी की जा रही है। और आज सारे देश में जो कोविड ट्रीटमेंट देने वाली सभी अस्पताल में मॉक ड्रिल की जा रही है ताकि हमारी सारी हॉस्पिटल कोविड केस देश में बढ़े तो संपूर्ण तरीके से तैयार रहे।
Now, we will take a look at the mock drills that were being conducted at that Safdarjung hospital where the health minister this morning paid a visit. My colleague Vedant sent us a report from there. But before that, let's look at what's happening in Bengaluru as well. There as well, these mock drills are being conducted, and Srija is joining us for more on this. Srija, take us through the steps being taken in Bengaluru as a part of these mock drills.
Well, it's already been 10 minutes into the mock drill right now, but we have entered trial center.
All right, so preparations going on in Bengaluru as well. So these are really across states. Let's take a look at what these mock drills really look like. What are the preparations being done at hospitals? Take a look from this report at the Safdarjung Hospital in Delhi.
I come to you from Delhi's Safdarjung Hospital where a COVID mock drill is currently underway. In fact, we just saw Union Health Minister Mansukh Mandaviya also visit the Safdarjung Hospital here in Delhi. And remember, these mock drills are being done very seriously to take stock of infrastructural readiness to fight COVID in the event of a possible rise in cases. Now, I'll just take you through how this mock drill is actually taking place. Remember, there are also dummy patients that are there in this particular mock drill, and this is a triage area. This is where the dummy patients will be first taken to. This is an area where patients with least severity are actually put. So here, let me take you through the triage area. Remember, all of the preparations are being done almost in a way as if a real emergency has actually unfolded. So here is, of course, the registration desk, which is where the registrations will take place. We can see, you know, the SpO2 machine also kept here. Now, this is a COVID testing area. The COVID testing area where dummy patients will be brought. Here, of course, if I can just ask my camera person to show you, we have 2 dummy patients already here. This is where the COVID testing will take place in the as part of the mock drill. And after this, the dummy patients after COVID testing will be put here. So these 2 here are dummy patients, if I can just ask my camera person to show you. And these are beds that are not connected to ventilators. These are just for patients with least severity. And here, as you can see, the dummy patients also have to undertake a test and fill this form. Now, after this, the patients will be taken to the SARI ward. Now, what is the SARI ward? The SARI ward is the severe acute respiratory illness ward, and this is the SARI ward here, right in front of the triage area. So this is a ward where beds are connected to central oxygen supply and ventilators as well. So here, as you can see, doctors also in PPE kits, fully prepared. And this is also something during the mock drill, a stock of PPE kits, shoe covers, masks all of that will also be taken out. These are ventilator beds. All of these beds are connected to ventilators, and at the same time, these are also connected to a central oxygen supply. Now, other than that, if I can also show you an inventory of medicines, emergency medicines, COVID-related medicines will also be maintained. Now, this is that particular stock of drugs, antibiotics, medicines that would be required during COVID. So this is the Sari ward here, where beds are connected to ventilators. Now, a couple of important things that will be taken stock of as far as infrastructural readiness is concerned. One, of course, is beds earmarked for COVID, ventilators, oxygen cylinders, fully functional oxygen generating plants, PSA plants. So all of that will be taken stock of. Let me in fact get in a word from a doctor present here, ma'am. These mock drills are currently underway, and all of you are fully prepared in a sense. I mean, all of you are wearing PPE kits. So how important are these mock drills right now?
I think these mock drills become very important because they let us know where we are lacking. They let us know how prepared we are. Although we have learnt a lot from the previous waves of COVID, this virus and its various variants should not be taken lightly. Every variant brings about different features to the virus. Every wave is different, and we must be prepared for this, and mock drills help us to assess our preparedness.
Right. So as ma'am is telling us, mock drills help in assessing the preparedness, and also in a sense whether India is ready to take on a possible surge in cases, because as of now the positivity rate as well as daily active cases is considerably low. So it's not a cause for panic, but of course with 3 horrific waves behind us, India this time is aiming to be ahead of the COVID curve and making sure that any possible surge is taken on head on by the country. In New Delhi with camera person Sushil Rathi, Vedant for NDTV.